Claudia LaBorde, and I'd like to talk to you a little bit about wrist injuries. You've most probably been sent here by your physician because you've had some type of wrist fracture. These are very complicated injuries because of the way the wrist is made. As you can see here, the wrist joint includes two large bones, the ulna and the radius, which articulate or hook up to 8 smaller bones called carpal bones, which articulate with 5 smaller bones, the metacarpals. This is a very complicated joint because there's so many bones involved. You may have thought when you injured your wrist that I'll probably be in a cast from 3 to 8 weeks, and then after the cast is removed, I'll be fine, I'll be able to move my joint. But any time you keep this many bones together still, you will have severe stiffness. That's why you're in therapy. Many of you will still be in a cast. It's so important that you understand how to participate in your exercise program and that you understand as much as you can about the wrist so you can get well as quickly as possible. First thing I'd like to teach you would be some exercises. Exercises are very important, and I'll go through quite a few of those with you on this film. Before you leave, however, your therapist will tell you exactly how many of each to do at home and how often each day before returning. Before I show you exercises, I'd like to first go over what we call the 1-hour rule. Many people say, how many repetitions of each should I do? We suggest starting with 5 to 10 repetitions of each exercise. You're the only one who can decide how much to do in between there, however. If you hurt while you're doing the exercise, I'm not as concerned as if you hurt for up to an hour or at least 2 hours after. If the pain that's increased with exercise doesn't decrease by 1 or 2 hours later, you know that you've done too much. Please don't stop your exercises, just cut back. If you've done 5 of each exercise, you may want to cut back to 2 of each exercise. Again, if 1 to 2 hours later you still hurt worse than when you did your exercise, you may cut back even further. If you don't hurt worse, start increasing your repetitions by 1 or 2 each every exercise session. Another question is, how often should I do my exercise? Many times we start our patients out 3 times each day to go through a set of specific exercises. We would like to progress you to every 2 hours doing some type of exercise routine. The more that we can push you in regards to exercises without making your pain or your swelling worse, the faster you'll get well. So I know that's important to you and it's important to us. Some of the exercises I'd like to start with will be those of the hand. Please listen to these and go through these yourself right now, because these are called tendon gliding exercises. The tendons are what hook the muscles of your forearm onto the bones of your hand and give you motion in your hand. These tendons glide through the wrist area, so it's important that you do some type of exercises to make these glide. If you're still in a cast, these are the exercises that you will definitely start with. The first exercise is called a hook fist. You pull your hand into a hook position. The big joints of your hand here are kept straight. They're called your metacarpal joints or your knuckle joints. And the little joints are pulled down as far as possible into a hook. When you straighten, you try to straighten out as much as you can and then bend down as much as you can. If you have any limitations at all in these joints, this is an exercise that you definitely should do. The next exercise is called a straight fist. Here's where we focus on the big knuckle joint here. And you pull your fingertips down as far as possible, bending the big knuckle joints down as far as possible. And open and close. This is the straight fist exercise. You'll hear this quite a bit here at our clinic. The last finger exercise would be curling the fingertips down into a fist and then opening up. And this is something that you're all trying to do, I'm sure, make a full fist. The other exercises, however, are just as important. The thumb joints are often involved with a wrist fracture because Your thumb tendon runs right along your radius, which is the bone most often fractured in a wrist injury. Often it becomes adhered, or scar tissue causes it to be slightly stuck to the radius if it's been fractured. So this may be an important exercise for you, especially if you have an external fixator device or some type of plate in your forearm. This is an exercise where you spread your thumb out as far as possible and then bring it back in. If you would have your hands flat on a table, you would be able to do this exercise. However, to do the next thumb exercise, you'd have to have your thumbs turned up on the table and pulling your thumbs upward. This is called thumb abduction, where the thumbs are pulled out and away from the fingers. Thumb abduction and thumb extension. Two very important thumb movements, often limited in a wrist fracture. Now, of course, there are some exercises for your wrist that we want you to do. If you are in a cast, some type of external fixator, you won't be able to do these right now. However, they're very important for you to understand. If you are out of the cast or able to remove your splint, these will be exercises that you will focus on. The first will be wrist extension. That's lifting the wrist up as high as you can, and wrist flexion. These are exercises that we'd like you to attempt on your own with your own muscles. You may not be able to move near as far as I'm moving, but this would definitely be your goal. As you can see, when I lift my wrist up, I'm trying to make a fist. And when I bend my wrist down, I'm opening up my hand. Doesn't have to be opened up all the way, but it should be open. When I'm lifting up, I make a fist and hold, and I'm pulling up as hard as I can. And then when I'm bringing it down, I'm opening my hand somewhat and pulling down as hard as I can. The reason why it's important for you to try to make a fist when you're doing this active exercise, using your own muscles, is because if my hand is open, I'm using my finger extensor muscles to lift my wrist up. Usually that's easier at first. However, I really want to train my wrist extensor muscles to work again. Those are the muscles that were made to lift the wrist, and they're really a lot stronger than the finger extensors. At first, they may not feel that way, and it's real easy to get in a bad habit of having to use your finger extensors to actively lift your wrist. The opposite is true about bending your wrist down. We want to use our wrist flexors and not our finger flexors, but you usually won't have as much of a tendency to do this. This is only for active motion when you use your own muscles. When we teach you exercises which involve pushing your wrist with your other hand, we'll do it just about the opposite. So let's review that. Wrist extension, hold. You pull hard with your muscles, even pull hard enough to make your arms shake. And then you relax and bend down. Pull hard into wrist flexion. Up and down. Another important wrist exercise is what we call ulnar. That is pulling the wrist towards the little finger side of the hand. And radial deviation. Pulling the wrist towards the thumb side of the hand. Here again, you would pull as hard as you can and hold. Bring up, and then pull in the other direction as hard as you can. As you can see, the hand is not made to move as far in the radial direction as it is in the ulnar direction. The last type of wrist exercises that we'll encourage you to do, what we call pronation and supination. This involves turning the palms of your hands up as far as possible and then down as far as possible. As you can see, to make sure that I'm doing this correctly, I have my elbow bent at about 90 degrees. It's very easy to cheat if I have my elbow straight, because I can have my hand supinated and turn with my shoulder, causing me to look like I'm really pronating more than I am. You could put your elbows bent in this position and turn down into pronation and hold, and up into supination and hold, down into pronation and hold, and up into supination and hold. Unless your therapist tells you otherwise, I'd like for you to do each of these exercises 5 times each, 3 times a day, until your next visit. Remembering the 1-hour rule, if you're able to tolerate up to 10 repetitions of each, do up to 10, but no more. What I've taught you today are called active range of motion exercises. They don't involve pushing with your other hand at all. At your next visit, we may add some of these to your routine.